Hello, everyone, and welcome this evening. We hope you can hear and see us loud and clear. Apologies for the slightly late start. We just had some technical difficulties and we're waiting for our colleagues to join. Now, I just want to start by welcoming you to this live webinar event, which is shining a spotlight on the physiotherapists of Gaza. And this event is brought to you in partnership with Medical Aid for Palestinians, who work collaboratively with physiotherapy partners in the Palestinian Ministry of Health Gaza and here in the UK. My name is Rachel. On behalf of myself and panel members Uzo and Arissa, we are UK-based physiotherapists who volunteer and support both Medical Aid for Palestinians and the Physiotherapists of Gaza. And we are here in an independent capacity, and we're very grateful we can live stream from the MAP YouTube account. But I need to make it clear any views expressed from the hosts and guest speakers are personal views and not those of MAP unless specifically stated. We are joined by our speakers live from Gaza, but this is totally dependent on the availability and strength of internet connections. So if we cannot communicate via this video link, we will try and communicate via messenger services. So please be mindful of this. And I hope you can all see Ali on the screen with us. The structure of this session is 3 separate talks followed by a live Q&A session. The chat function on YouTube is disabled, so all questions need to be asked through direct messaging on the AHPs for Humanity Instagram account or the Twitter account. Thank you for those who have already submitted questions. This is a free webinar, but we are asking for donations, no matter how small, made to a charity of your choice. We have circulated the links for the Medical Aid for Palestinians donation site, a fundraiser for Palestinian physios, and also for individual fundraising pages. So why are we here? Well, access to rehabilitation is a basic human right and international standards exist. So even in the most devastating situations, such as war and conflict, people have the right to quality humanitarian responses so they can live with dignity and have the right to assistance. As we pass the 10-month mark of this war, we have seen the continued destruction of the healthcare system in Gaza, and this is severely affecting the ability to provide rehabilitation. And this is on top of the significant gap and complexity in rehabilitation provision for the people of Gaza. Now, Gaza needs an enormous surge response in rehabilitation efforts. And we know this must be communicated with the World Health Organization Rehabilitation Task Force. And we wanted to take a moment to recognize all of the partners working across Palestine, both past, present, and future, including the community-based organizations and all the NGOs. And we want to say thank you for all you do. And despite the most challenging and tragic conditions, the physiotherapists of Gaza continue to work tirelessly to provide whatever rehabilitation services they can on the streets, under canvas, in the remains of clinics, and in the small number of hospitals that are operational. The physiotherapists of Gaza are some of the most incredible, intelligent, compassionate, and committed clinicians that we have ever worked with. And this is why we are shining a global spotlight tonight on our incredible colleagues. Over to you, Uzo. Uzo, would you like to introduce our first speaker?
Yes, so our first speaker this evening is Mr. Ali Abed. Ali is the program manager for Medical Aid to Palestine and has worked exclusively with rehabilitation physiotherapists over the past 5 to 6 years in Gaza.
Hello everybody, this is Ali speaking from Gaza. I'm working as a program officer in medical aid for Palestinians. So I'm going to talk about the current situation in Gaza today, which is 21 of July of 2014. So I'm going to cover 5 main sections, which is about death and injuries toll, displacement, the health situation, war situation, and the food insecurity. Talking about the current displacement in Gaza, on the 13th of October, after 1 week after the Israeli war have started in Gaza, the Israeli occupation forces asked the civilians in Gaza city and in the north of Gaza to go to the south of Gaza Wadi. As a result of this, around 1.7 million population have been displaced, which account for 75% of Gaza Strip population. So those people currently, they are living as internal displaced people. They are living in very bad living conditions, in tents and shelters affiliated with the UNRWA, and in other open lands in a very difficult and miserable conditions. Thinking about the death and injuries toll, and since the 7th of October 2023, so the military offensive in Gaza, when it has been started, the total death toll until this day, while I'm speaking, based on the Ministry of Health of Gaza records, it's more than 38,000 persons who has been killed, which account for 1/3 of them who are women and children. About the injuries toll, around 98,000 people have been injured. 1/4 of them are women and children. Also, 158 journalists has been killed. More than 10,000 people are considered as missed and who has been under the rubble and not buried so far. About the health situation, since the 7th of October, the Israeli occupation forces used to systematically destroy the healthcare facilities, which include hospitals and primary healthcare centers. And below is a snapshot of the real picture of the impact on the health facilities due to the current war. So a total of 464 attacks have been documented against the healthcare facilities, which led to 727 fatalities plus 933 injuries. Also, 113 ambulances has been affected either partially or totally. A total of 17,000 children now they are living without one or both of their parents, so they are classified as unaccompanied or separated children. About the number of cases which are in need for advanced surgical treatment conditions, the Ministry of Health in Gaza have indicated that there are more than 12,000 injured people who are in need to get advanced surgical treatment and are now trapped in Gaza due to the current case of blockade and closure. Talking about the pregnant women, more than 60,000 pregnant women, they are now living in very bad conditions with lack of proper nutrition and lack of access to healthcare, and they are at high risk of pregnancy. There are 310 healthcare providers who has been detained by the Israeli occupation forces. Those people has been taken from the hospitals they are working in during the Israeli military incursion all over Gaza Strip. Also, 32 hospitals out of 36 hospitals have been reported to be damaged either partially or totally. Also, a total of 19 hospitals out of the 36 hospitals all over Gaza Strip are not functioning and are out of service. About the primary healthcare services in Gaza. In Gaza, we do have 97 primary healthcare centers. So 59 out of them are not working and not functionalizing so far. About the reality of infectious disease due to improper water conditions and lack of water and sanitation services in Gaza, the Ministry of Health in Gaza and the World Health Organization have reported around 865,000 of acute respiratory infections, plus a total of 485,000 of acute watery diarrhea, and more than 81,000 cases of acute jaundice. Talking about the water, sanitation, and hygiene situation, as a result of the Israeli military war against Gaza and due to the current offensive, there are extensive damage to the water networks, water pipes, and desalination plants. And as a result of absence of electricity, lack of essential resources, lack of trucks, pumps, and supplies to provide safe and accessible water for the population, we can say that the current situation that it's not possible to meet the sphere's minimum standard in emergency, which is 15 liters per person per day. So as per the figures from the WASH cluster, we can say that only 3 liters are available for every person per day. Also, as a result of scarce water, infectious disease begin to multiply in Gaza as presented due to the large number of cases with jaundice and watery diarrhea. MAP currently is working to respond to the current emergency situation related to the WASH, and currently we are working to develop a proposal to intervene in WASH using the integrated intervention approach. So in this regard, water tracking, sanitation, and hygiene services will be provided to the IDPs who are living in scattered and unserved shelters in the middle area and in the south of Gaza. Also, hygiene promotion will be another intervention, like distribution of hygiene kits to be provided for the families of the IDPs who live in schools and shelters in the middle and in the Khan Yunis area. Talking about the food insecurity, currently a total of 32 patients who are, most of them, they are children, they have been reported died due to the current case of malnutrition. Also, a total of 1.1 million are experiencing catastrophic food insecurity. 31% of the children who are aged 6 to 23 months, mainly in the north area of Gaza, are now malnourished. Also, the World Health Organization have reported that 3,500 children to be at risk to die due to severe malnutrition. Thank you very much.
Ali, thank you very much indeed. So without further ado, we'll move to our next speaker. So our next speaker is a physiotherapist, and he's the director of Physiotherapy and Rehabilitation Services for the Palestinian Ministry of Health in Gaza. And this is Dr. Sami Oemar.
Hi everyone, my name is Sami Oemar, Director of Physiotherapy and Rehabilitation Unit, Ministry of Health, Gaza, Palestine. I am going to present the current situation of physiotherapy and rehabilitation services at Ministry of Health in Gaza. About the staff we have around 148 physiotherapists who work in 16 departments divided between hospitals and primary health care. We have 11 hospitals who provide physiotherapy services. All of them provide inpatient services, and 3 out of the 11 provides both in and out physiotherapy services, and all the 5 primary healthcare physiotherapy centers provide only outpatient services. At the moment, we have only 2 hospitals who still functioning and to provide a physiotherapy services, and they are located on the south of Gaza after the displacement and evacuation of the people from north to the south. And regarding the primary healthcare centers, only we have 1 primary healthcare center who provide a physiotherapy services. Overall, we have only 3 physiotherapy centers provide physiotherapy and rehab services from 16 departments. Only 3 who are still functioning. After the war, some of the international and national organizations started to help in the field of rehab and physiotherapy, and they established a field hospital. Some of them they provide like mobile clinics, like International Medical Corps, ICRC, MSF France, MSF Belgium, UK Med. Norway also started to reactivate the physiotherapy and rehab centers among the clinic and mobile clinic, as well as some of the field hospital. Now about the statistics of the injuries, wounds, and the casualties for the period starting from October the 7th until May, the end of May 2024, we registered approximately about 3,379 of the amputees, 1,689 of complicated orthopedic cases, 844 traumatic brain injuries, 1,689 of the spinal cord injuries, 2,534 of burns and other disabilities, around 2,534, and this is according to the RTF, which is Rehabilitation Task Force, which established and managed by World Health Organization. We lost 8 of our staff members who used to work in MOH due to the bombardments and shellings and rockets and missile, which is come in regular basis on the civilian. And Isa, Auda, Saleh, Muhammad, Ahmad, and Wasim, and other ladies, we lost them, and unfortunately they are some of the most outstanding mates, and they are clever, and they used to deliver a good service in MOH. Looking forward for support in burn management. ICU, limb reconstruction, amputation, traumatic brain injuries, and spinal cord injuries. So we seek and appeal for an expert and experts who come and help us in dealing with these cases. As well as we are in massive need of all types of assistive devices because we run out because there is so huge number of patients who really need assistive device, wheelchairs, crutches, toilet wheelchairs, and other assistive devices, air mattresses, spirometers, all sort of assistive devices are badly needed in MOH in order to try to rehabilitate and manage and to deal with cases who are reside in hospital. And the number are increasing hugely because of the streets and the destruction and the demolition of the infrastructure of the cities and the roads due to the war and the shelling and the bombardment acquired all over the city. Afterward, absolutely, we are in massive need in rehabilitation and renovations of the building and department and the structure. We have some of the departments are totally destructed and some of them they are partially damaged and destructed. As well as we lost plenty and many of our equipments and devices which are essential for the physiotherapy and rehabilitation services. Thank you so much. Looking forward to hear and to receive your help in the presentation and the needs I presented for you. Thank you so much.
Many thanks, Dr. Sami. So up next, we have Tarneem Hammad. She's the Advocacy and Communications Officer for MAP. And she's going to discuss the call for a global rehabilitation community and also how we as physiotherapists and healthcare practitioners can help.
Hello everyone, this is Tarneem with Medical Aid for Palestinians. The healthcare system in Gaza is severely strained due to the ongoing war and also an already existing blockade for 17 years now, making it extremely difficult for health facilities to provide and meet the need of the people in Gaza. And that also includes physiotherapy services. However, physiotherapy remains a very hopeful profession as you make people move better, recover, and live their best lives each day. The patients who seek rehabilitation services in Gaza have often endured severe trauma, both physical and psychological. Many of them have suffered from life-changing injuries, and their journey to recovery is complicated by the continuous threat of violence, by the occupation, and also by the blockade. I've seen patients on crutches moving through crowded streets to avoid danger, carrying gallons of water, and queuing for hours to secure basic food supplies. And in the middle of all of this, Gaza's physiotherapists continue to work tirelessly to serve their patients and help them move better, while they face extremely difficult and challenging circumstances marked by shortages of medical supplies, lack of access to health facilities, and the constant need to adapt to the current circumstances. We at Medical Aid for Palestinians urge the global community of physiotherapists to stand in solidarity with their colleagues in Gaza. Your support can make a significant difference by advocating for more resources, more training, and for fostering international support to help these dedicated and inspiring physiotherapists continue their vital work for the sake of the patients in Gaza. Together, we can make a difference. Thank you all.
So we will now be moving on to the Q&A section of the evening. Sadly, with the reality of the situation, Dr. Sami and Tarneem have not been able to join us live, but we do have Ali from Gaza currently. So thank you so much for joining us. We'll just start with a few questions, if that's okay. I've had a couple come in. So the first one we have, Ali, please jump in for this. Is how are physio students continuing their studies and how can we support them?
Okay, thank you very much, Rusa, Rachel, and Uzo. So actually, given the fact that all of universities in Gaza and college which provide physiotherapy and rehabilitation education has been totally destroyed by the Israeli occupation forces, we can say that the university education now, it's stopped since the 7th of October. That's why there is no formal education for the physiotherapy students. So the only way we can say that those who are at their last year in their physiotherapy, university degree, they might have some kind of internship training inside the hospitals, which are still functioning, which are 4 hospitals so far, providing physiotherapy and rehabilitation. So only a kind of clinical training and internship for those students. Other types of informal education, nothing. However, some universities, they have started to use the online education for their students. But as a Gazan and as an inhabitant of this city, I can say that this is not of that, kind of effective way to deliver this training, since the infrastructure has been totally destroyed by the Israeli, and there is lack of access to internet and to electricity. So it is still kind of humble, trials to try to provide any education for those students to allow them to join what they can of their study currently in Gaza.
Thank you, Ali, for that. I think it really does make us think about how we can provide that education and that support to the students in Gaza, particularly when that infrastructure is not there currently, and just the innovative ways that the universities, even after the destruction, have been trying to provide that locally. It sounds incredible. And I think it's a bit of food for thought for us, because we're hoping this is going to be reached globally, and actually what can we be doing from our ends to help maybe support you guys and support the students as well. So thank you. The next question, Ali, I think this will be probably really well placed for you to answer, is as somebody who hasn't been to Gaza and doesn't really understand how the system's set up, and also just how you're getting support at the moment, how you're getting equipment, how you're getting things in, can you explain to us a little bit about what do you feel is the best way we could be using our resources to help get you the supplies and get the physios all the supplies and equipment that they need? Because that's a question we hear quite a lot actually from this end.
Yeah, thank you very much, Urusa. So once this offensive, Israeli offensive have been started against Gaza, MAP was able to procure more than 40 trucks which contain medical supplies and medications, which has been delivered to the Ministry of Health here in Gaza. So talking about the needs are huge. The needs are tremendous, since we can say that the main approach of treatment, it's based on field hospitals, which is being run by some international non-governmental organization. MAP is one of those organizations, and we have started to prepare to launch a comprehensive medical point, or a center, which will have around 8 to 9 medical clinics, physiotherapy and rehabilitation. It's going to be one of these clinics to try to provide the rehabilitation services for our patients here. And this clinic will be located in the middle area of Gaza, which contain more than 700,000 IDPs. So talking about what we can get of support,
Based on the figures presented by Dr. Sami, we are talking about more than 4,000 patients who lose their extremities, and they are in need for assistive devices like the crutches, like the wheelchair. And currently, I can tell you that you cannot find any wheelchair available to be given for any patient, since it's not allowed to cross the borders. Despite of this, MAP was able to procure, with an amount of 170,000 US dollar to deliver a wheelchair for the Gaza city for the patients there, which have been delivered and distributed in the city. Currently, we are trying to do our best to procure whatever we can. However, the limited access toward the entry of medications, disposable and assistive devices, it's being highly controlled. That's why the access, it's not that easy, and the needs is still increasing with the increasing number of casualties and injuries every day.
Thank you, Ali. I think that was very very insightful, and I think when I only recently actually found out about some of the equipment or some of the things that just seem so basic that just aren't allowed into Gaza via Israel. And I think I could be wrong in saying this, but I think crutches were definitely one of the ones that somebody had told me was actually not being allowed into Gaza. I guess another question, Ali, that we've had is thinking about, I know at the moment we're talking a lot about trauma physiotherapy, particularly with what's been happening. But of course, the neurological side, the respiratory side, all the other sides of physiotherapy don't suddenly stop in the war, people with long-term health conditions and everything. So in terms of physiotherapy, I think Dr. Sami touched on what specialities and support would be really helpful. And I think Dr. Sami, you've actually just joined the call, so thank you and welcome. And I hope your internet connection stays strong. And maybe this question could come to you. But in terms of physio specialities from around the world, what would be most helpful for you at the moment? Maybe, Dr. Sami, are you able to speak a few words or answer that question? I think maybe, Ali, if we come to you for sort of your response and then see if Dr. Sami can join.
So Arusa, talking about the needs. Yes, Dr. Sami, go ahead, please.
Yes, sorry for being late, and internet connection, electricity, we have problem here. So happy to be with you, and hopefully this webinar will help victims and casualties, and also physiotherapists here in Gaza. For basically the problem here, displacement and evacuation, and and we talk about hospitals and physiotherapy departments are out of function. We hardly receive patients. Most people, they live in tents and in shelters, and they are evacuated from their places. There is no accessibility to come to hospitals. The inferior structure, roads, and no assistive device, no ways. There is very difficult ways of communication or people to come to hospitals, even for the essential health. Probably they can't even come to hospital for the essential health services. A part of the team and the staff, also they have problem in commuting to hospitals. Now there is a problem in beds in hospitals. The patients are over. We can't accommodate many patients who are really need to be resident in hospitals, because we have limited beds. We have to discharge patients early, so they don't receive the proper medical attention. No physiotherapy. We can't touch and see all the patients who was in hospitals. There is no instruction for most of them. They leave hospitals early and they go to for tents and different parts. The patients who remain in hospitals, only the very difficult cases, like patients who are still, they have trauma problems, they are they have traumatic brain injury, they have spinal cord injury, they are burn more than 50%, complicated surgical conditions, amputees. This is the sort of patients who reside and remain in hospitals because they are medically unstable. So the service we provide from our point of view as a physiotherapist and rehab, only how to mobile them in bed, how to avoid some contractures like bed sores, like to do some to avoid stiffness, avoid the complication in muscle atrophy and etc. But we have severe shortage in equipments, the essential equipments of moving and transferring, like bed, like mattress, air mattress. We don't have wheelchairs. We don't have crutches. We don't have spirometers for the ICU patients. This is a critical problem for us. Apart from this, we have really very complicated patients who suffer from multi problems. So they have fracture with burn. They are amputees with burn. They are in ICU and they are amputees or they are burn. This is very complicated. The huge number of these patients really requires good attention, medical and physiotherapy as well. We are not so expert in managing multiple cases or multiple problems. I mean, like when you deal with patients who are intubated and suffers from burn, as well as he has a fracture. So if there is any chance to have a volunteer expert in dealing with such cases, that would be very helpful for us. Really, this is our demand and our call. We need someone to come expert in these situations. We don't a usual physiotherapy who come to do like a training and to do physiotherapy like the usual physiotherapy we can do. We need a specialized one, like in severe traumatic cases, because we have cases we never seen before. This is the actual, probably I summarize the view of how severe the cases are, how bad the medical equipments and the shortage of assistive device and the basic instruments and tools we use to have it here in Gaza.
Thank you, Dr. Sami. I think we can all appreciate how the complexity, or maybe actually, I don't think we can appreciate the complexity that you are probably seeing in Gaza. And I think that answers a lot of the questions about the plea for call of the people who are trained in sort of plastics, who are trained in burns, who are trained in amputee management, trauma management, of reaching out to organizations like MAP and others that are hopefully trying to get physiotherapists to be going into Gaza. And I think one thing that there's a couple of things that you just said. Firstly, you and other physiotherapists also have to put yourself in danger to go to work and to go to your clinics and to provide the care. So thank you for everything you do for all the others as well, because I think it's really important that we acknowledge what you are doing, because it's so easy for us to say, oh, patients, but you're putting your lives out there. So thank you for everything you do. And then the other thing that you just raised is, I'm thinking from my UK hat, of following people into the community. Okay, they've left hospital early, but let's give them community physio. But they're probably not even in their homes. You probably don't even know where people are being discharged to. Is there scope for physiotherapists to be going out into the community, Dr. Sami, or is it mostly just in the hospitals at the moment?
Let me also remind me to thank you all our mates who join us in this meeting. We are so thankful on behalf of Minister of Health and the Physiotherapy Association in Gaza. This is a very grateful, and we appreciate what you do for us, what you used to do before, and what you are doing right now. And we wish that we'll see you in better circumstances later on, hopefully. Now, for the problem now that most of people, they are evacuated from hospitals because we have only 2 hospitals who are still functioning. One in the mid zone and one in the south, in Khan Yunis and Deir al-Balah. This is the only 2 hospitals they are functioning, which is, we used to have 16 hospitals we used in MOH. Now only 2 remaining functioning. Most of patients who just, if they are medically stable and they can go out hospitals, they leave hospitals. What we do, we try to arrange and to do some cooperation with national NGOs who provide mobile team, outreach team, community-based rehabilitation programs, who can go and visit according to the geographic area. They try to see and to search for those patients who left hospitals, okay, and to try to manage with them some sessions, basic physiotherapy sessions, to do the training instruction to avoid as much as possible of the complication can acquire, because intense, it's too hot, neglected, no electricity, there is no medical awareness, many epidemics. There is the situation in the tents and shelters is so bad, and it's a sort of infection and a lot of bad medical conditions, especially when you talk about injury and they are not cured, and it's not close surgical conditions, so it's more prone to infection. So they require a good dressing, good care, good hygiene, good antibiotics, and as well as the physiotherapy instruction and training to avoid limb contraction and stiffness and etc. And if there is any possible, they can afford them with some of the assistive devices to enable them to move, to go to toilet and to come back and to do the basic activities of daily living. The huge number is out of hospitals and they have no access to come to hospital. And there is, we have problems in dealing with the huge number of cases require physio and rehabilitation. So we depend and we rely in outreach and mobile team. But unfortunately, we don't secure and guarantee the quality of service provided, because most of them, they are volunteers. There is no chance for us to look after and to see how well and how qualified and how the protocol of physiotherapy is going properly.
Thank you, Dr. Sami. I think this question, again, I'll just come to you while we have you. I think I've got a couple of questions. So in terms of physiotherapists, sadly, I feel like every time we speak to somebody in Gaza, we hear about more physiotherapists that have sadly been killed and passed away. How many physios do you estimate are still providing physio services in Gaza?
Well, the estimated number of the physiotherapy are killed so far around 50 physiotherapists. 10 of them used to work in MOH, and others, they work in NGOs, and they work in private clinics and other societies. And some of them, and a lot of them who used to they are students and they work in universities. They are faculty members of the education faculties in Gaza universities. So we talk about 50 to 70 physiotherapists are killed until the moment.
Yeah, I think the numbers are quite high, and I think I think just today we only found out about a few more that were killed in July, actually. We have 41 on our list, Dr. Sami, but I'm sure there are probably some physiotherapists that we don't know about that have probably been killed in this terrible sort of conflict. And then in terms of, I know physiotherapy, of course, we're trying to restart the clinics and restart providing physiotherapy, but is there scope for any other rehabilitation in Gaza at the moment? So what about things like psychology, particularly with all the trauma, as well as maybe, I don't know if there's occupational therapists or speech and language therapists in Gaza. Could you tell us a little bit about how the team are working as a whole? And maybe Ali, you could jump in after Dr. Sami for that same question.
For the outreach team and the community-based rehab programs, it's about like we have a doctor, we have nurse, we have physiotherapy, we have a psychologist. This is the team. Okay, they go do assessment for the patient and to see what type of treatment is required. Medically medications, like they need dressing from nurses, they need the mental sessions, they need the physiotherapy. According to the assessment, we try to provide the service from the mobile team and outreach team or the community-based programs. Now, for the hospitals, only we don't have any OPD right now. Only what we provide is the inpatient services that we go for the daily morning round with doctor and nurses. We see the patients and how they are medically stable, how they will respond, their response to physiotherapy sessions. And we try to talk to families regarding that if he is being displaced or evacuated or discharged, that the priority for him that to have like a bed, to have air mattress, to do some training. We try to train family how to deal with patient in case being discharged, because the turnover is so quick, because the number of beds are not equitable to the needs of the patient, need to be resident and inpatient.
Ali, is there anything you'd like to add to that as well?
No, actually nothing. So just to say or to mention that the current approach, it's mainly to try to is focusing on mobile teams to try to reach patients since they are not able to access hospitals. And like said by Dr. Sami, only 2 hospitals are still functioning in Gaza. Yes, and that's it.
And Dr. Sami, before you could join the call, we were just saying there was a question, and you also answered it in your presentation actually, about what physiotherapists can be doing to help, what equipment needs there are. But is there anything else you would like to say to us, to the world, about how we could be helping you at the moment?
Well, there is so many, the huge number of patients and casualties. They need, at the meantime, they need programs of rehabilitation, and for minimum of 3 or 5 years, they have still long-term of rehabilitation. We have about 4,000 amputees. We have about 2,000 of patients who suffer from spinal cord injuries, about 1,500 who suffer from severe head trauma, and most of them they are medical unstable, and they have problems in stability and comprehension. Most of these cases they need long-term rehabilitation, and they require to have attention for at least 5 years of time. All these patients, they need equipments. They need good physiotherapists. We need the tools and instruments. We need the expert and the expat who will come and to help and to try to aid in dealing with such a complicated and difficult cases. All these requirements, we need plenty of assistive devices because of the accessibility of the roads and the huge needs of these instruments and equipments. This is badly needed, and most of these equipments are being banned to come to Gaza. So far, from 6 months, We didn't receive any sort of any items of assistive devices, which makes things very hard for us.
Yes, thank you, Dr. Sami. I think that is the message for tonight, actually. I think that's been the key and that's been the theme sort of throughout from Ali as well as from your presentation and everything. So thank you. I think, Ali, can I ask you this question? And Rachel, maybe you would like to jump in, actually. Is MAP now asking for physiotherapists to volunteer to go to Gaza? What stage is MAP at the moment?
So actually, currently, the main focus it's on providing, the emergency medical teams. However, most of them, the volunteers who are coming from the United Kingdom or from other places, Jordan, for example, Palestinians who are in the diaspora countries. So they are mainly surgeons, general surgeon, trauma surgeon, OT nurses, for example, ICU nurses, anesthesiologists. So currently, we didn't call for any physiotherapist to come at this point of time. However, when the ceasefire will be granted, the physiotherapist, the volunteers from our network of expats in the UK will manage to have them to be deployed to Gaza to support the medical teams here in Gaza.
Great, thank you. And I think there were some questions actually about other organizations and non-profits and everything. And I think there are so many people doing lots of work, and it's really difficult to speak about all the different organizations. But I think hopefully we've highlighted some of the amazing work that MAP is doing currently and will be continuing to do currently. And Ali, did you just want to mention some of the stuff that you've previously said about the sort of psychological counseling side just on here?
Yeah, if we talk about the psychological, side, I can tell you that the whole medical community and Ministry of Health, they are totally traumatized because you are talking about more than 9 months. Those people who have been working to serve their people in hospitals, which has been attacked by the Israeli occupation forces and evacuated repeatedly. The psychological traumas, it's highly prevalent currently. However, talking about the psychological aspects for the injured people in Gaza, MAB have started a new project which is about providing, wound care for the patients. The main methodology for this project, it's about providing health services through the mobile teams, and we have employed 2 medical teams, and there are psychological counselors who are available in these teams to go to the tent to provide the medical and nursing and psychosocial care for those patients. Beside, the provision of psychological or psychosocial interventions in our medical points, which are located between the middle area and the south area of Gaza Strip. The final thing is that regarding this, talking about the psychosocial support, I think a lot of things, a lot of interventions, it should be done because the people here, they are lacking the basic things of their living conditions. So a lot of support are required to try to address, the psychosocial aspect for the patients and for, the medical community here in Gaza as well.
Great, thank you, Ali. I think there was just a comment about somebody wrote about physiotherapists not currently being deployed. I think the complexity to actually get the medical staff out there has been very challenging, and I think it's prioritizing the current needs. I think there's lots of us waiting at the bid to come over to help as much as we can, but I think MAP and sort of everybody's doing what they can to prioritize the needs of the people of Gaza, and at the moment it is the surgical and the medical needs as much as there is physiotherapy need, of course. I think Dr. Sami's just disconnected. I just want to wrap up the Q&A with a little echo of everything that's just been said by Ali and Dr. Sami. And particularly, I asked one of the physiotherapists, Ala, if he had any messages. And do you know what? It's the exact same messages. And I don't know if you work together or work with each other, but the experiences are echoed throughout, I think, Gaza, about the difficulties with studies and not being able to access the internet, the difficulties and the challenges of actually the health workers being exhausted from providing what care they could have provided or have been able to provide. And I think sometimes we when we go to work, if we've not had a good day, we can feel actually disheartened if a patient's not recovered the way we wanted, or we've not been able to get them that little bit of equipment that they needed. But that's been the reality for the past over 10 months for the people in Gaza. So actually we need to say a really big thank you and appreciate the amazing work that the physiotherapists in Gaza are doing, and especially as well, Ali, you and Tarneem as well. So thank you. I'm going to hand over to Rachel.
Thank you. Uzo, would you like to say anything before we conclude and close?
I think this is really directed towards Ali. Ali, I guess it's a statement and also a question to a certain extent, but the rehabilitation professionals who are currently displaced and not working as physiotherapists, and those who are working as physiotherapists, as my colleague just said, are going to be exhausted. Eventually, once there is a ceasefire, they are going to be exhausted. And I wonder how it will be managed, because will they be in any fit state to return to work based upon the fact that they will have been a part of effectively the conflict? And, you know, with the psychological trauma and the physical trauma, you know, and it won't just be them, it will be their families as well. So I almost wonder, so my question here is, you know, eventually, what will be the requirement that Gaza will need in terms of external physiotherapists who do not necessarily work in Gaza coming to the aid of our colleagues who, frankly, I suspect are exhausted now and will be further exhausted once this conflict eventually starts to subside?
Thank you, Uzo. So the answer is very simple. We hope to see a ceasefire for this, you know, war or for this conflict. So once this will be granted, because, you know, the exhaustion exposed, you know, on our medical community and teams here, simply we will need, you know, emergency medical teams, mainly physiotherapists and, you know, rehabilitation specialists from outside, to try not to train the local staff, but to provide the service. So currently the main approach is toward service provision rather than capacity building, rather than training. So we need, you know, specialists, we need people from outside, like you, from, you know, United Kingdom, from our, you know, volunteers all over the world, just to come to serve the patients here. And that's it. Thank you.
Thank you so much, Ali. Dr. Sami, I can see you've rejoined. We're just concluding now, and we've had a lot of comments through the social media handles to say thank you both for everything you do for the physiotherapists, the health services, and the patients and people of Gaza and across Palestine. So thank you so much. Dr. Sami, I don't know if you want to come in with any final thoughts. If not, we will move to a close. Okay. I just want to thank everyone for coming. I am aware there was some slight technical difficulties at the beginning, and there's been 2 simultaneous streams happening. So we're also aware of our global partners and physiotherapists across the world who will be watching this at a later time because of the time differences, but we really wanted to make this as accessible as possible. Please do feedback through the social media accounts and to MAP directly. If you would like any follow-up sessions or a session in the future spotlighting the work of healthcare professionals in Gaza, and obviously particularly from a physiotherapy or rehabilitation perspective, and we can help coordinate. And just a final call to the global rehabilitation community to join the call in calling for an immediate ceasefire in Gaza and across Palestine, and to call for a protection of healthcare workers, and that includes physiotherapists, to prevent any more needless deaths and injuries. So please join our call for a ceasefire and for protection of healthcare workers under international law. Please use your platforms, voices, and any positions you have to do so. Now, we would like to finish by dedicating this webinar to this this session to our physiotherapy colleagues in Gaza. I'm trying to share a video, so please bear with me, where we will just recognise, sadly, our physiotherapy colleagues who are no longer with us. Please bear with me. As we mentioned earlier, we are aware of over 40 physiotherapists, 41 on our list, who have sadly been killed, but we are aware this list needs to be updated given some tragic losses this week. But please take a moment to remember those colleagues we have lost.
We remember and mourn the loss of our physiotherapy colleagues and their lives.
Ahmed Abuibaid, physiotherapist.
Ahmed Asraf, student physiotherapist.
Maya Al-Wahidi, student physiotherapist.
Mira Al-Masri, physiotherapist.
Imtiaz Amira Haroon, student physiotherapist.
Ihab Abu Sameh, physiotherapist.
Ola Al-Dura, physiotherapist.
Ahmed Al-Masari, physiotherapist.
Muah Al-Hamza.
Kareem Abu Shariha, physical therapist.
Mohammed Ibrahim Darwish, physiotherapist.
Bayan Awada, physiotherapist.
Sajida Sabi.
Sharazad Al-Akras, physiotherapist.
Muhammad Ali, physiotherapist.
Naeem Al-Kuka, student physiotherapist.
Wasim Yaya Al-Ustaz, physiotherapist.
Jamil Hamdan, physiotherapist.
Amani Al-Absi, physiotherapist.
Shaima Sabi, physiotherapist.
Thank you so much for joining us, everyone, tonight.